First part of the discussion is on angiography, the procedure for locating blocks in blood vessels, and the second part on angioplasty, the procedure for removal of blocks. What is angiography? Angiography, known in short as angio, is the procedure by which blood vessels of the body are visualized, usually by injecting contrast dye. Most popular contrast media are iodinated dyes which cast shadows of the vessels on X-ray imaging. Usually contrast media are injected directly into the vessel to be imaged using small tubes known as catheters introduced through blood vessels in the wrist or groin. When the imaging is done by continuous filming, it is known as cineangiography. Currently, the recording is onto the computer memory from the image intensifier and taken out as a record on DVD. Visualization of the vessels in the retina, the light-sensitive layer of the eye, which processes vision, is done by injecting a fluorescent dye known as fluorescein. Hence, that form of angiography is known as fluorescein angio. Dye-less angio is possible with magnetic resonance imaging, where the signals from the moving hydrogen particles in blood give the image. This is known as magnetic resonance angio. Conventional angio using X-ray equipment is used for imaging the blood vessels of the heart and is known as coronary angio. Imaging of peripheral vessels of the limbs is known as peripheral angiography. Imaging vessels of the kidney is known as renal angiography. Cerebral angiography is done to visualize the blood supply of the brain. Pulmonary angiography visualizes the vessels of the lung. Intestinal blood supply is seen by mesenteric angiography. Rarely, the individual can be allergic to the contrast dye. In an individual with compromised or borderline kidney function, the dye can rarely precipitate kidney failure. Kidney function is routinely checked before angio. Check out the related video on what is angioplasty on this channel. What is angioplasty? Angioplasty is in simple terms the removal of a block in a blood vessel. Most familiar form of angioplasty is coronary angioplasty, removal of blocks in the blood vessels of the heart. How is angioplasty done? Angioplasty is done using small tubes with balloons attached at the tip known as balloon catheters. These catheters are introduced through the blood vessels in the wrist known as radial artery or the groin known as femoral artery and moved under X-ray cine imaging fluoroscopy to reach the destination vessel. Before passing the balloon catheter, it is usual to pass another wider catheter known as guide catheter and a guide wire through it to cross the blocked segment. The balloon catheter is then threaded on the wire to push it across the block. Once the balloon is across the block, it is inflated using a syringe-like mechanism, indeflator, inflation-deflation device. The balloon is filled with dilute X-ray contrast, iodinated dye, prior to insertion so that it can be visualized by fluoroscopy. The inflating device has a pressure gauge attached to it so that the inflation pressure can be monitored. Undue pressure within the balloon has to be avoided to prevent damage and sometimes rupture of the blood vessel. Here is an X-ray of balloon filled with contrast inflated inside the block. The guide wire is also seen. This is a schematic diagram of balloon inflation within a block. What is done to prevent recoil of the vessel after angioplasty? The recoil of a blood vessel after angioplasty can be prevented by implanting metallic stents within the segment from which the block was removed by angioplasty. Stents are tiny spring-like structures kept in folded position like a folded umbrella and expanded using a balloon while inside the blood vessel in the desired position. Stents are mounted on balloon catheters for introduction into blood vessel and pass through the guide catheter over the guide wire which was positioned during angioplasty. Stents could be bare metal stents made of nitinol, cobalt chromium, stainless steel or platinum based alloys. For better efficacy, they can be coated with special medications which prevent recurrence of blocks at the implantation sites due to cell overgrowth. These are known as medicated stents or drug-eluting stents. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.